Hello guys, it's Gavin, fifth year medical student at Makerere, and today we are discussing safe male circumcision. You can abbreviate it as SMC. Safe male circumcision is the surgical removal of the foreskin of the penis. The foreskin, you can divide it into shaft foreskin, the outer foreskin, and then the inner foreskin. The benefits of safe male circumcision is that in relation to HIV, it decreases the HIV transmission rate by approximately 60%. Let's look more into details about the provision of safe male circumcision services, and the process has 6 stages. First, we are going to identify the priority groups, and these are all males. However, the priority age groups are from 15 to 45 years. However, it doesn't exclude infants. Infants can also be offered safe male circumcision services. What are the different methods we can use to offer the safe male circumcision services? We have 4 methods. This conventional surgical method using the double slit method. That's the first method we can use. The second method is Shang method for most male adults, and it is the most recommended because it has quite a number of advantages. It doesn't require injections, it doesn't require sutures, and the patient only has to come back once. We have the Mogen method for the infants. Then we have the WHO pre-qualified methods. When you are using some of these methods, we have challenges. For example, while using the disposable method, you're going to have a choice between you using a method that has issues with waste disposal, and also you're not very sure about its quality. Those are challenges you have to first face while choosing some of these methods. Then you're also going to have a challenge when using reusable methods. Some of these methods, you have questions about sterility. Are you sure about how you're going to sterilize this? How good you're going to sterilize this? Some of these instruments after you've used them on previous patient. So those are some of the issues you have to put at the back of your mind. So after you've chosen your method, you clearly have your method, you're going to have, so you have to screen this patient. Back to the patient. Is this patient eligible for circumcision? Let's first talk about what can make a patient not eligible for circumcision. A patient is having an STI, sexually transmitted infection. No, you don't have to circumcise this patient. What you have to first do, treat this STI, and then after the patient is healthy, back to normal, you can go ahead and do the circumcision. Next, a patient is having a bleeding disorder. No, you're not supposed to circumcise this patient because, you may end up with excessive blood loss. What you're supposed to do is defer the circumcision, and then you refer this patient for specialist care. A patient is having chronic illness, for example, diabetes. You're not supposed to circumcise this patient. You have to defer the circumcision and then refer the patient for specialist care. Some other issues include the patient having penile abnormalities. No, you're not supposed to circumcise this patient. You defer the circumcision and then you refer the patient for specialist care. So after you've screened the patient and the patient is not having any of these issues, the first thing you're going to do, we go to tetanus immunization. Tetanus immunization, the patient is ideally supposed to receive 3 doses of tetanus immunization. The first dose is on day 0. Just before you circumcise the patient, ensure that you've given this patient a TT immunization. Then the second dose is at 28 days after the circumcision. And finally, the third dose is at 6 months after the circumcision. You have to consent or assent this patient. That's our next process. And under this, you explain to the patients the risks and the benefits of the circumcision. And then you have to ensure that the patient has understood the risks and the benefits, and then they are ready to take it up. You can either get a signed consent or an implied consent, and then you can go ahead with your circumcision. So you've consulted this patient, you're ready to offer them the service of circumcision. Guys, let's try to test these patients for HIV. Since we know that the male circumcision has really minimized the risk of HIV transmission, we should offer these patients with the HIV testing services. So that's our next step. You may test this patient for HIV and then you find them they're HIV positive. That does not stop you from offering this patient no circumcision services. You will circumcise this patient and then you refer them to the HIV caring services around your area. The final step after offering the service is following up with the patient. And in the follow-up, you're trying to identify for any adverse effects, and also you're trying to look at how is the patient faring after the surgery or after the procedure. And for the conventional surgical method, you're supposed to follow up the patient at 2 days, 7 days, after 14 days, and finally after 6 weeks to identify any of those adverse effects. Then for the other methods, you're supposed to follow up according to the guidance from the manufacturer of the device you used.